Adverse effects and drug interaction of isoniazid. First is hepatotoxicity. The risk of hepatic damage is more in chronic alcoholics, elderly patients, and rapid acetylators. It is reversible on discontinuation of the drug. Patient receiving isoniazid should be monitored for symptoms like anorexia, vomiting, jaundice, and nausea. Hepatotoxicity. The risk of hepatic damage is more in chronic alcoholics, elderly, and rapid acetylators. Rapid acetylators may risk of hepatic damage is more. Rapid acetylators may risk of hepatic damage is more. It is more in chronic alcoholics, elderly patients. And this hepatic damage is reversible on discontinuation of the drug. Patients receiving isoniazid should be monitored for symptoms like anorexia, nausea, vomiting, and jaundice. Peripheral neuritis. It is a dose related toxicity. Okay. Peripheral neuritis is a dose related toxicity. Isoniazid is structurally similar to pyridoxine. Hence, isoniazid competitively interferes with the utilization of pyridoxine. Peripheral neuritis is a dose related toxicity. Isoniazid is structurally similar to pyridoxine. Hence, isoniazid competitively interferes with the utilization of pyridoxine. It also promotes the excretion of pyridoxine. Peripheral neuritis is more common in slow acetylators. Rapid acetylators में hepatotoxicity is more common. Slow acetylators में peripheral neuritis is more common. So peripheral neuritis is a dose-related toxicity. Isoniazid is structurally similar to pyridoxine, and so it competitively interferes with the utilization of pyridoxine. Isoniazid also promotes the excretion of pyridoxine. Isoniazid also promotes the excretion of pyridoxine, and this peripheral neuritis is more common in slow acetylators. Pyridoxine 100 mg per day is generally given along with isoniazid to reduce the risk of peripheral neuritis in alcoholics, diabetic patients, and HIV positive patients receiving एंटी ट्यूबरकुलर थेरेपी. तो आइसोनियाजाइड जो है वो पायरोटॉक्सिन के स्ट्रक्चरली सिमिलर होता है, इसलिए उसके पेरिफेरल यूटिलाइजेशन से compete करता है. ठीक है, और उसके एक्सक्रीशन को भी प्रमोट करता है, जिसके कारण पायरोटॉक्सिन कम होगा बॉडी में. So pyridoxine 100 mg is generally given along with isoniazid to reduce the risk of peripheral neuritis in alcoholics, diabetic patients, and HIV positive patients. Isoniazid के कारण पायरिडॉक्सिन का इफेक्ट कम होगा, उसका एक्सक्रीशन भी इंक्रीज होगा, जिसके कारण पेरिफेरल न्यूराइटिस होता है. दैट्स वाई पायरिडॉक्सिन 100 मिलीग्राम पर डे इज जनरली गिवन अलॉन्ग विथ आइसोनियाजाइड to reduce the risk of peripheral neuritis in alcoholics, diabetic patients, and HIV positive patients receiving anti-tubercular therapy. It is also used for the treatment of isoniazid induced peripheral neuritis. ठीक है, पेरिफेरल न्यूराइटिस के रिस्क को रिड्यूस करता है और उसके ट्रीटमेंट में भी यूज़ होता है. तो पायरिडॉक्सिन आइसोनियाजाइड के पेरिफेरल न्यूराइटिस के रिस्क को कम करता है in alcoholics, diabetic patients, and HIV positive patient receiving the anti-tubercular therapy, and it is also used in the treatment of isoniazid induced peripheral neuritis. Risk reduce करने के लिए the dose is 10 mg per day. Treatment के लिए the dose is 100 mg per day. Other side effects are fever, skin rash, arthralgia, anemia, GI disturbances, psychosis, and rarely convulsion. Fever, skin rash, arthralgia, anemia, GI disturbances, psychosis, and convulsions. Isoniazid inhibits the metabolism of phenytoin, carbamazepine, warfarin, and increases the level of these drugs. So isoniazid के कारण phenytoin, carbamazepine, warfarin का लेवल इंक्रीज होगा क्योंकि इनका मेटाबॉलिज्म इनहिबिट होता है, एंड दस इट रिजल्ट्स इन दैट टॉक्सिसिटी। आइसोनियाजाइड के कारण फेनिटोइन, कार्बामाजेपिन और वारफेरिन जैसे ड्रग्स का टॉक्सिसिटी होगा।